How to lower high blood pressure naturally. Your blood pressure is an essential indicator of your overall health, which is why monitoring it regularly, and understanding what the numbers mean, is important. Especially if you're at risk for hypertension or high blood pressure. High blood pressure should never be ignored, as it can lead to health complications, diseases like heart disease, retinopathy, eye disease, and chronic kidney disease, and even death. An easy way to keep tabs on your blood pressure levels and ensure they aren't in an elevated range is with an at-home blood pressure monitor. There are an array of blood pressure monitors out there that make tracking your readings easy, and once you know your numbers, you can take the necessary steps to get them within a healthy range. While medications may be necessary to lower your blood pressure, reducing high blood pressure at home is possible with some dedication. Even if you're on doctor-prescribed medication, there are steps you can take to reduce your blood pressure naturally. 12 natural ways to reduce high blood pressure at home. In addition to determining whether you need medications, which you should discuss with your doctor, healthy lifestyle choices can make a significant difference in reducing high blood pressure. Try incorporating the following changes and habits into your daily life. 1. Lose weight if you're overweight. Weight loss is an important part of reducing high blood pressure, especially for people with obesity, as it's a strong risk factor for hypertension. People who are overweight can have between a 2 to 6-fold increase in risk of developing hypertension. With less weight, the heart and arteries do not have to work as hard. The heart muscle and the muscles in the arteries do not thicken. Thickening can lead to further increases in blood pressure because of reduced give or elasticity of blood vessels. Talk to your doctor or registered dietitian about a safe weight loss plan that will work for you, or consider trying a support app like Noom. Even modest weight loss in these patients, 4 to 10 pounds, is associated with a significant reduction in blood pressure levels. However, a study of more than 740 people found long-term reductions in blood pressure only persisted with weight loss exceeding 2% of the person's initial weight. Ready to build healthier habits? Start Noom. Created by psychologists, doctors, and researchers, Noom is a lifestyle change. 2. Exercise. Regular exercise not only aids in weight loss, but also helps decrease high blood pressure. A study found blood pressure decreased in the hours after an exercise session regardless of a person's age, sex, and other characteristics. This effect can result in somewhere between a 10 and 15 millimeters of mercury reduction in systolic blood pressure levels. Most doctors recommend at least 30 minutes of moderate-intensity aerobic exercise each day. Aerobic exercise gets the heart rate up in a gradual and consistent fashion, helps to stretch the heart and arteries, and also increases blood flow to the organs. If you can't do 30 minutes, recommends at least 15 to 20 minutes a day, 5 to 7 days a week. Some aerobic exercise options include walking, running, swimming, using an elliptical machine, cycling, and playing tennis. 3. Decrease your salt intake. Salt is the enemy of high blood pressure. When you eat too much salt, it increases the amount of fluid that enters the bloodstream and arteries from the surrounding tissue, which raises the pressure in the arteries. While you may not have to remove salt from your diet completely, avoid foods very high in salt like chips, French fries, salted nuts, soups, store-bought salad dressings, processed foods, and cheese. 4. Avoid excess caffeine. Drinking too much coffee or too many energy drinks that contain caffeine isn't recommended for people with high blood pressure. Caffeine is a form of adrenaline. It constricts the arteries and raises the heart rate, both of which increase blood pressure. If you have high blood pressure, ask your doctor whether you need to adjust your morning coffee habit. High levels of caffeine can worsen blood pressure control. The Food and Drug Administration, FDA, considers the equivalent of 4 cups of coffee a day, 400 milligrams, safe for the general population. But most experts recommend 200 milligrams or less, 2 cups of coffee, for people with established hypertension. 5. Drink more water. Staying hydrated may be an important way to keep your blood pressure reading in a normal range. When you're dehydrated, the body produces stress hormones to maintain blood flow to organs. This response can increase blood pressure. 6. Drink less alcohol. A large study conducted by the American College of Cardiology found moderate alcohol consumption, defined as 7 to 13 drinks a week, can substantially increase risk of high blood pressure. Alcohol can increase your body weight, deplete the body of magnesium and potassium, and dehydrate you. What's more, alcohol increases stress levels, which cause elevated blood pressure over time as well. Build better drinking habits. 7. Try blood pressure support supplements. A small study in the International Journal of Hypertension found magnesium supplementation can reduce blood pressure in small amounts. Talk to your doctor before taking magnesium supplements, especially if you have kidney disease. You can also safely incorporate high magnesium foods into your diet. Recommends foods like leafy green vegetables and unsalted almonds. Beyond magnesium, research in the British Journal of Clinical Pharmacology suggests potassium, L-arginine, vitamin C, cocoa flavonoids, beetroot juice, coenzyme Q10, controlled-release melatonin and aged garlic extract may also help reduce blood pressure. 8. Avoid processed foods. A healthy diet plays an important part in reducing high blood pressure, so many doctors recommend reducing consumption of processed foods. Processed foods are often loaded with sodium and saturated fats, two things people with hypertension want to avoid. A good rule of thumb is to have multiple colors of food on your plate. He recommends eating more berries, bananas, beets, dark chocolate, kiwis, watermelon, oats, garlic, lentils, pomegranates, cinnamon, unsalted pistachios and fermented foods like yogurt. 9. Reduce stress through meditation and rest. Chronic stress can lead to chronic elevations in the stress hormones cortisol and adrenaline. These hormones constrict the arteries and cause weight gain, which further increases blood pressure. He recommends reducing stress by using breathing exercises, practicing meditation, completing physical exercise, practicing yoga, logging quality sleep, taking breaks throughout the day, spending time in nature, listening to music and eating a balanced diet. Quit smoking. Smoking leads to constriction of the arteries acutely, and long-term use greatly contributes to the development of high blood pressure. One study in hypertension found smoking can cause an immediate but temporary increase in blood pressure. Take the steps you need to quit smoking if you have hypertension. 11. Eat dark chocolate. Small amounts of dark chocolate aren't just tasty, they might help lower blood pressure as well. One study found people who didn't have hypertension and ate more dark chocolate had lower blood pressure than those who ate less dark chocolate. The dark chocolate should have high amounts of cocoa, aim for at least 70%, and should be low in sugar. It's likely that a compound in dark chocolate known as flavonoids releases a substance known as nitric oxide, which relaxes blood vessels. 12. Try the DASH diet. If you're unsure how to change your diet to lower blood pressure, recommends trying the dietary approaches to stop hypertension, DASH diet, which is the best studied dietary approach to helping with hypertension. It consists of foods rich in potassium, calcium, magnesium, fiber and protein and low in saturated fat and sodium. Try CALM for free. If you're unsure how to change your diet to lower blood pressure, Dr. Mehta recommends trying the dietary approaches to stop hypertension, DASH diet, which he says is the best studied dietary approach to helping with hypertension. It consists of foods rich in potassium, calcium, magnesium, fiber and protein and low in saturated fat and sodium.